Welcome, and thank you for joining us for this recorded webinar for the Be Informed section of the Homeless Emergency and Active Readiness Toolkit, or HART. This webinar is brought to you by Step Up, Cal-ICH Interdepartmental Emergency Preparedness Group. This is the second of a 4-part webinar series on the toolkit. Stay tuned until the end of the video to learn more about the upcoming videos in the series. During this webinar, you will be hearing from Gabrielle Watson with the California Interagency Council on Homelessness, or Cal-ICH, Thelma Sanders with Cal-ICH, Lucy Kasdin and David Modersbach with the Alameda County Health Care Center for the Homeless, and Cari Porter with the California Governor's Office of Emergency Services. In this video, we will discuss the importance of being informed, how being informed supports collaboration, which will include an overview of both the homelessness response system and the emergency management system, how being informed helps meet needs and fills gaps. Here we will include an example of an exemplary practice about how Alameda County became better informed by listening to the voices of people with lived experience of homelessness. Lastly, we'll discuss what's next in the webinar series. Now I'll turn it over to Gabrielle Watson to get us started.
Hello, I'm Gabrielle Watson, and I'm a specialist on the local initiatives team with Cal-ICH. Thank you for joining us. In our last webinar, we provided an introduction of the Homeless Emergency and Active Readiness Toolkit, or HART for short. And we covered the basics of how it was created and how to use it. HART has 3 main sections: be informed, get connected, and take action. Our focus today is on the first section of the toolkit, be informed. Be informed emphasizes the importance of understanding both the emergency response system and the homelessness response system in order to meet the unique needs of people experiencing unsheltered homelessness during disasters and emergency. This section of the toolkit aims to support understanding across these 2 very different systems and aims to bridge the gaps so that these systems can work better together. The primary goal of this webinar is to help the audience be informed about the 2 primary systems that support people experiencing homelessness during disaster and emergency: the homelessness response system and the emergency management system, and to support increased collaboration across systems to better meet the needs of people experiencing homelessness during disaster and emergency. Additionally, we want to highlight the importance of centering voices with lived expertise when learning about the needs of people experiencing homelessness during disaster or emergency and the gaps in services that need to be filled. I'd like to begin with a discussion around collaboration and how being informed strengthens collaboration. When systems understand one another, they can better communicate and collaborate. Often, in the realms of emergency management and homelessness response, it can feel that there are so many differences, such as in terminology or structure, and this can make it really difficult to partner and to partner well. This portion of the webinar aims to break down those barriers and help these 2 systems understand one another to support collaboration and meet the needs of people experiencing homelessness in disaster and emergency. It is important to have inclusive emergency planning to assist people experiencing homelessness during disasters and emergencies. Working with the homelessness response system, local jurisdictions can enhance their emergency operations plans to provide effective services. For this next portion of the webinar, we will spend time learning about the homelessness response system and the emergency management system. I will now turn it over to Thelma Sanders, an analyst with Cal-ICH, to provide an overview of the homelessness response system.
Thank you so much, Gabrielle, for that great introduction and overview. Hello, everyone. My name is Thelma Sanders, and I'm an analyst with Cal-ICH. I'll be providing an overview of the homelessness response system and how it functions across our state to support individuals experiencing homelessness. The Homelessness Response System is a collaborative network of various organizations and agencies committed to assisting people experiencing homelessness. This system encompasses various stakeholders, including community-based organizations, housing authorities, government agencies, faith-based groups, food banks, and assisting shelters, among others. These entities work together to offer various essential services to address the immediate and long-term needs of people experiencing homelessness. The overarching goal of the Homelessness Response System is to facilitate a swift transition from homelessness to stable, permanent housing, ensuring that individuals receive the support they need to rebuild their lives and maintain permanent housing. Continuum of Care, or COC, serve as a central organization within the homelessness response system in each community. There are 44 COCs in California that serve as the administrative entity as defined by the United States Department of Housing and Urban Development, or HUD. Most COCs in California are geographically defined by counties or collections of counties. The leading agency of COCs can be local governments, nonprofit, or community-based organization, coordinated entities, or joint power authorities between the city and county governments. COCs fund housing and services within a community focused on moving people experiencing homelessness to stable housing and maximizing their self-sufficiency. Another important element within a COC is coordinated entry. HUD requires COCs to design and implement a coordinated entry process in their service area. The coordinated entry process is a shared, standardized process developed by each COC to connect people experiencing homelessness or at risk of homelessness with available services and resources in their community. The coordinated entry process is intended to help communities prioritize individuals who need assistance most. Coordinated entry provides access to services such as existing shelter, housing, and supportive services. Coordinated entry is intended to allow individuals to access all necessary services through a single entry point, to develop a clearer and more effective coordination of services across the community, and to more quickly match individuals with the services and supports that they need. COCs also serve as the funding coordinator for their regions, receiving state and federal funds that are shared with service providers to provide housing and supportive services. Some of the key services provided include existing shelter, which offers immediate short-term relief, transitional housing, which serve as a temporary solution while individual works towards permanent housing, rapid rehousing, which provides short to medium-term rental assistance and supportive services, and permanent supportive housing, which combines housing and supportive services to help individuals maintain stability. Additionally, street outreach often plays a key role in locating and connecting with people experiencing homelessness in unsheltered locations such as streets, parks, cars, and abandoned buildings. In addition to supporting basic needs, street outreach links individuals to essential services, including health care, mental health support, substance abuse treatment, and housing resources. Supporting people experiencing homelessness is crucial, not just during disaster planning or response, but at all times. Homelessness is a complex issue that affects individuals and families across various systems, such as housing, healthcare, social welfare, and employment. Continuous support is essential for addressing their immediate needs, connecting them to necessary resources, and helping people transition to stable housing and self-sufficiency. By offering ongoing support, communities can work towards ending homelessness and improving the overall well-being of those impacted. Continuous support for people experiencing homelessness also contributes to creating a more inclusive and equitable society It allows individuals to access essential services, healthcare, and employment opportunities. Moreover, providing continuous support acknowledges every person's inherent dignity and value, irrespective of their housing situation. By focusing on long-term solutions and support, communities can aim to address the root causes of homelessness and work towards sustainable interventions that promote stability and security for all individuals. Lastly, an additional area that CLCs are responsible for is data. CLCs collect data about the people it serves and the housing and services offered within the CLC service area. This data assists CLCs in planning and coordinating services and funding to prevent and end homelessness in their community. CLCs and homelessness response service providers play a crucial role in understanding and identifying the needs and locations of people experiencing homelessness. The county emergency planning process relies heavily on this data to support critical planning efforts before and during disasters or emergencies. California's 44 CLCs collect client-level data and information on service provided to individuals and families experiencing or at risk of homelessness who access services through their local Homeless Management Information System, or HMIS, including information about clients' identities, needs, utilization of services, and destinations. The information collected in HMIS is used to match client to services, improve system coordination, track system effectiveness, and evaluate progress towards ending homelessness. CLCs must maintain HMIS and share data with the state of California and HUD. At the local level, HMIS data can be utilized to determine existing shelter counts, bed usage, service utilization, and housing program availability during disasters. And it can also be used to ensure that individuals have accurate information about impending emergencies. Many communities also utilize by name lists of residents experiencing homelessness. By name lists can aid communities during disasters by providing real-time information on people's locations and necessary assistance, coordinating efforts for transportation, evacuation, and resource allocation for emergency shelters and supplies. Another way that CLCs collect data is through point-in-time counts. CLCs must conduct a point-in-time or PID count of people experiencing homelessness on a given night in January. The shelter PID count is completed annually, and the people experiencing unsheltered homelessness must be counted every 2 years. The PID count helps estimate the number of individuals and families in the community experiencing homelessness, including those who may not be accessing services. Data collected during the PID count can be used by the Homelessness Response System and emergency management agencies in advance of and during a disaster or emergency to anticipate the needs of people experiencing homelessness and living unsheltered. Those are the basics of Homelessness Response System. Thank you for listening. I will turn it back over to Gabrielle.
Thank you so much for sharing, Thelma. Next, we want to get informed about the emergency management system in California. Different types of emergencies call for various types and levels of response. An acute emergency, such as a small fire, may call for only a fire department response. A wildfire or flood may require a more significant response from multiple jurisdictions and sectors. A pandemic might require extended support from the state. This portion of the webinar presents emergency management as an integrated system that communities use as a framework to reduce vulnerability to hazards and manage disasters. I'll now turn it over to Cari Porter from Cal OES to give us an overview of emergency management.
Thank you. My name is Cari Porter, and I serve as the Program Manager for the Community Planning Unit in the Planning, Preparedness, and Prevention Directorate at Cal OES. The Community Planning Unit, CPU, formed in 2019, supports local emergency planning with an emphasis on the whole community. A key role is the coordination of county emergency operation plan reviews to ensure that emergency plans incorporate best practices, protect and accommodate vulnerable populations, and establish procedures for alerting, evacuating, and sheltering individuals during an emergency. Extra attention is given to the plan's enrollment and inclusion of culturally diverse populations and individuals with access and functional needs. With that in mind, I've been asked to provide an overview of emergency management in California, discussing a whole community approach and an overview of the emergency management structure in California. The culturally diverse communities located throughout California have differing needs and expectations related to emergency management. These communities may include Indigenous peoples, equity priority communities, people of color, low income, unhoused, LGBTQ+, or other underserved groups, including those with access and functional needs, AFN. While no two disasters are ever the same, virtually all incidents disproportionately affect these underserved populations. The vulnerability of individuals and groups to disasters varies with geography and physical location, as well as economic, socio-historical, cultural, and environmental factors. The capacity to anticipate, cope with, and adapt to an emergency is an important factor of vulnerability. Engagement with and understanding of the needs of communities that experience higher risk, a lack of access, or have vulnerabilities can help prevent gaps and inequalities in planning, response, and recovery efforts, decreasing suffering and loss of life. Whole community planning helps to ensure culturally diverse communities, the private sector, and non-governmental organizations, NGOs, are given the opportunity to voice their needs. A California best practice for whole community planning is to develop an official access and functional needs advisory committee that includes community representatives affiliated with government and non-government agencies, community-based organizations serving individuals with access and functional needs, disability organizations, community advocates, including unhoused coalitions, and people with lived access and functional needs experience of varied types. Using an inclusive process ensures you are planning with, not for the community, and results in the development of better products and stakeholder buy-in. Proactive collaboration with all relevant partners is crucial to meeting the needs of people experiencing unsheltered homelessness during emergencies. A consideration when developing plans is to dedicate specific subsections to explaining how the unique needs of diverse communities and individuals will be addressed, including for people experiencing homelessness living unsheltered. Individuals experiencing homelessness face distinct challenges during emergencies, including limited access to transportation, reliable communication channels, and resources, as well as possible discrimination or bias in shelters towards people experiencing homelessness. A function-based approach offers a flexible framework for integrating the access and functional needs of individuals in emergency planning, response, and recovery efforts. This approach looks at the capabilities and the needs of individuals instead of relying on perceived vulnerability based on diagnostic categories or population characteristics. The CMIST framework organizes needs into 5 categories. Communication, individuals who may have needs that interfere with the receipt of and response to information require information to be provided in an appropriate and accessible format. Maintaining health, individuals who may require personal care assistance to maintain their activities of daily living. Independence includes individuals who function independently if they have their assisted devices. Support, safety, and self-determination recognizes an individual's right to maintain agency in their life. And transportation includes people with transportation needs because of age, disability, temporary injury, financial hardship, legal restriction, or those who do not have access to a vehicle. Emergency management is an integrated system that communities use as a framework to reduce vulnerability to hazards and manage disasters. California's emergency management structure is a multi-tiered system designed to coordinate efforts across various levels of government and with the private sector during emergencies. At the core of this system is the Standardized Emergency Management System, SIMS. which unifies all elements of the state's emergency management community. SIMS provides a flexible, adaptable, and expandable response organization to address all hazards of varying magnitude and complexity. The Standardized Emergency Management System, SIMS, is the cornerstone of California's emergency response system and the fundamental structure for the response phase of emergency management, coordinating disaster response among police, fire, and other agencies. SIMS was developed after the 1991 East Bay Hills fire to improve communication and coordination. The system unifies all elements of California's emergency management community into a single integrated system and standardizes key elements. The SIMS incorporates the use of the Incident Command System, ICS, the state's Master Mutual Aid Agreement, and the Operational Area, OA, concept, and the Multi-Agency Coordination, MAC, system. State agencies are required to use the SIMS, and local government entities must use it to be eligible for any reimbursement of response-related costs under the state's disaster assistance programs. Training and competency standards and SIMS ensures consistent use across all response levels. SIMS is scalable, 5-level system. Each level is activated as needed for an emergency, with most disaster incidents starting and ending at the local government level. All SIMS use the Incident Command System. We have the field level. Field level is where emergency response personnel and resources carry out tactical decisions and activities in direct response to an incident or threat. Local government. The local government level includes counties, cities, and special districts. Local governments manage and coordinate the overall emergency response and recovery activities within their jurisdiction. Operational area. An OA is the intermediate level of the state's emergency management organization, which encompasses a county's boundaries and all political subdivisions located within that county, including special districts. The OA facilitates and coordinates information, resources, and decisions regarding priorities among local governments within the OA. The OA serves as the coordination and communication link between the local government level and the regional level. The Cal-OES regional level coordinates information, resources, and state agency support among OAs within the mutual aid region and between the OAs and state level. The state level of SIMS prioritizes tasks and coordinates state resources in response to the requests from Cal-OES regional level and coordinates mutual aid among the mutual aid regions and between the Cal-OES region level and state level. The state level also serves as the coordination and communication link between the state and the federal emergency response system. The Incident Command System is a standard on-scene, all-hazard incident management concept. ICS integrates facilities, equipment, personnel, procedures, and communications operating within a common organizational structure to aid in the management of resources during incidents. The management protocol was originally designed in the 1970s for the fire service agencies in California and subsequently required through state legislation in 1993 as an element of the SIMS, and implemented nationally in 2004 as an element of the National Incident Management System, or NIMS. ICS is based on a flexible, scalable emergency response organization providing a common framework within which representatives from responsible agencies can work together effectively. It is applicable to small-scale daily operational activities as well as major mobilizations. Because of its standard operational structure and common terminology, ICS provides a useful and flexible management system that is particularly adaptable to incidents involving multi-jurisdictional or multi-discipline responses. ICS uses an incident commander or unified command to streamline authority and avoid duplication. There are 5 primary functions within the ICS management structure. 1, command management. At the Emergency Operations Center, the term management replaces command. 2, operations. 3, planning and intelligence. 4, logistics. And 5, finance and administration. An Emergency Operations Center, EOC, is the physical location at which the coordination of information and resources to support incident management activities, the on-scene response operations, normally takes place. An EOC may be a temporary facility or may be located in a more central or permanently established facility. An EOC may be organized by major functional discipline, such as fire, law enforcement, and medical services, or by jurisdiction, such as federal, state, regional, tribal, city, or county, or some combination thereof. A Department Operations Center, or DOC, is an EOC specific to a single department or agency where the focus is on internal agency incident management and response. They are often linked to and represented in a combined agency EOC by authorized agents for the department or agency. EOC shall be activated in accordance with the SIMS and organized according to the 5 functions of the system. The EOC staffing level should be established commensurate with the organizational need. An EOC is activated to support field level operations when an emergency requires additional resources or when requested resources exceed what is available from within the jurisdiction. Field incident commanders and EOCs will establish communications when the EOC is activated. Local government EOCs will establish communications with the operational areas, or OAs, the OA EOC when needed. The OA EOC will communicate via the Cal-OES region, which communicates with the State Operations Center, the SOC. The State Operations Center is operated by Cal-OES at the state level in SIMS and is responsible for centralized coordination of state resources and support of affected Cal-OES regions and operational areas. The Cal-OES regions are strategically activated to provide direct services and support at activated EOCs by communicating and coordinating situational information and resource requests. An Emergency Operations Plan, EOP, is the ongoing plan maintained by various jurisdictional levels for responding to a wide variety of potential hazards. Emergency plans are official and approved documents which describe the principles and methods to be applied in carrying out emergency operations or rendering mutual aid during emergencies. The purpose of the EOP is to outline the jurisdiction's all-hazard approach to emergency operations to protect the safety, health, and welfare of its citizens. These plans include such elements as continuity of government, the emergency services of government agencies, mobilization of resources, mutual aid, and public information. All local governments with a certified disaster council are required to develop EOPs in their jurisdictions that meet state and federal requirements per the California Emergency Services Act. This includes identifying potential evacuation areas and routes, measures for notifying and evacuating the public, and identifying potential shelter locations. Among other emergency planning considerations, local planning considerations should include the following elements: a threat and hazard identification and risk assessment, THIRA, and stakeholder preparedness review, SPR. Understanding a community's risk and capabilities allows planners to determine what they need to prepare for, if current capabilities need to be maintained or expanded, and how to close any capability gaps. Another is whole community planning approach. Integrated plans should address how a community will address its specific risk with the unique resources it has or can obtain. This requires an understanding of the composition of the population and its needs, along with the identification and involvement of community stakeholders in the planning process. Integrated planning should include all members of the community, including private businesses, other government entities, the socially underrepresented, and individuals with access and functional needs. According to the California Emergency Services Act, the access and functional needs population consists of individuals who have developmental or intellectual disabilities, physical disabilities, chronic conditions, injuries, limited English proficiency or who are non-English speaking, older adults, children, people living in institutionalized settings, or those who are low income, homeless, or transportation disadvantaged, including but not limited to those who are dependent on public transit or those who are pregnant. And finally, community involvement. Community members and leaders possess unique knowledge and perspectives about their constituents and should be involved in the integrated planning process. Community involvement helps emphasize that members have an active responsibility in preparedness and ownership of the plan created. So I want to thank you for listening, and I will turn it back over to Gabby.
Thank you, Cari, for sharing and informing us about emergency management in California. Next, I want to discuss another way that being informed helps. Being informed about the systems that support people experiencing homelessness is important. It is also important to have a comprehensive understanding of the needs of people experiencing homelessness, so service providers and emergency response teams can provide adequate support to them during disaster and emergency in a way that is actually helpful, that makes a difference, and can ultimately save lives. The best way to be informed is by listening to those with lived experience. The next speakers, Lucy Kasdin and David Modersbach from Alameda County, will be discussing their exemplary practice that is highlighted in the toolkit, centering voices with lived experience. They will walk us through how they developed and expanded response capabilities and how they involved lived experience experts in the process. Lucy and David, I will turn it over to you.
Hi, my name is David Modersbach, and I'm a grants manager at Alameda County Health Care for the Homeless Program. We're fortunate enough to be part a health center specifically focused on the healthcare services for people experiencing homelessness that's based in our local health department. Our reach covers the entire county of Alameda, and we provide both clinic and street and shelter-based healthcare services for people experiencing homelessness all over our county.
And hello, everybody. My name is Lucy Kasdin. I work alongside David. I'm the Deputy Director of Alameda County's Health and Homeless Services, and very happy to be here today. This has been an area of passion for both David and I over many years, and really starting with the recognition that traditional responses when it comes to emergencies so often leave out the needs of people experiencing homelessness, those living on our streets. And so this is an area where we have really invested over many years in terms of developing and honing in on our response. So we are very excited to be here today to share a little bit of that work with you all. And really going to start with kind of the three key elements. First, know and invest in the landscape in your community. The second, ensuring that people with lived experience are really the center of, guide, and inform your response. And the third, using the opportunities of everyday disasters that happen and disproportionately impact people experiencing homelessness to really continue to refine and develop that process and in your community. So I'm going to turn it back over to David.
Yeah, the first area is really to know and invest in the growing landscape of homeless services in your community. So before disasters even start, you should be working to develop working relationships in the whole landscape of homeless providers. We're continually working to identify opportunities to connect, strengthen, and grow our networks of providers, and developing relationships outside of the formal homeless response system as well. We do that through events, trainings, involvement. We step out of our comfort zone to really kind of get our hands messy with the range of homeless service providers. And that can include the formal systems of HMIS and coordinated entry, outreach providers, but it also includes clinics, grassroots providers, the faith community, advocates, and especially people experiencing homelessness. If you're not relying on your formal system and you're relying and you're tapping into the larger network, you can do things that your formal system can't really do. And one example that we'll talk about is how we are able to get masks out to people during a heat or a smoke emergency. We'll talk about that a little bit later, by not just trying to do it ourselves, but by using our grassroots and extended community providers. The second area is that it is critical to really center people with lived experience in your emergency planning and in your response. So always carrying out needs assessment, focus groups, getting input of people with lived experience and living experience of homelessness, to involve them in the planning, to be able to use them as messengers, trusted messengers, building those relationships of trust between us and the people we serve and the communities that we serve is super important in being able to push messages out quickly and get things to happen. And that really informs our response.
Thanks, David. And the third core area that we want to spend some time talking with you all about today is how you use those everyday disasters. And I just want to start by going back to what David ended with around building trust. It's when you show up in community with people during smaller incidents, right? That's how you build trust. And they know that they can count on you when things happen. And so I think that that is really the core of that as it relates to, again, in particular, those informal partnerships, that relationship with people directly with folks living on the streets, with the advocates and communities that support them that are really outside of kind of the formal homeless provider system. So there are three core pieces as it relates to how we respond to daily disasters. The first is convene, right? So we want to make sure we're always tracking. We know, for example, it's going to heat up here in the next couple days. We're always tracking and looking at kind of what is happening in terms of daily disasters that we can predict. Those generally have to do with the weather, of course. And so we are then proactively convening relevant partners to be able to develop a proportionate response to that, right? And that will look different in different parts of the region of our county. Heat, for example, impacts very differently, but we have ready email list of the people that we want to convene and are able to quickly convene those people. We're also using those daily disasters to then be able to, after them, debrief, bring back together that whole network of providers and say, hey, what worked well here, what didn't, so that we can continue to refine what it is that we're doing and get that feedback and kind of continually improve as a community what we are doing. And now we're going to move on to really wanted to spend a little bit of time talking in detail about kind of what we have labeled daily disasters, but really kind of, again, recognizing that so much of the work that we all do out there with folks is really are not things that are going to reach the level of kind of formal county, state, emergency declarations, and how we provide you all with some specific examples of situations where we've been really able to lean in, do this work, and develop and hone it over time. The first one was, I believe, in 2017. So starting in 2017 is when David and I really kicked off this work, responding to what was coming up the West Coast in hepatitis A outbreak among people experiencing homelessness. We really knew that we needed a response, seeing how quickly it was moving up. And so we, again, started with that landscape. Who are the trusted providers? Who is out there serving people? And I remember our first flyer also that we created with information about this, we immediately brought to our consumer advisory board and others with lived experience, and they cut out half of what we wrote. And so that, I think, was really a foundational learning experience about making sure that we're not the experts, right? Taking it, getting feedback on visuals, on what language was included, how we really were able to communicate out something that was scary and time sensitive to people in a way that they could understand, and being able to make sure that we were providing that information in a way that was really informed by people that we knew and trusted, that had trust with the community, so that we could have the biggest impact possible. And that really allowed us to both get information out to people, to be able to then, through these networks, activate and be able to go out and bring vaccine to people. But again, if you pop up with vaccine and you don't have the trust and you haven't done the work right, it really significantly lessens your impact. And so I'm going to turn it over to David now to talk about related work with wildfire smoke.
In around 2018, 2019, we began to experience, like everybody else, the waves of smoke and air quality emergencies due to wildfire smoke. We had created this kind of this community of response through the HEPA A stuff, and then we were able and lucky to build on that community of response, because we had quickly we got together 10,000 N95 masks to get out to unsheltered people, but we didn't really know how to get them out there. We had a handful of outreach teams and a few other handfuls of outreach teams, and we have a 750 square mile county. And we were like, well, how is this going to happen? And we just put the word out to our networks, our community networks and our grassroots networks. And we set up 4 different hub centers, got the masks to those centers, let the folks take it from there. And we had groups of people coming to pick up masks and take them out for that last mile, getting the stuff exactly to where people were. And we counted on those communities, those grassroots communities, to do that last mile and get that stuff out there. And that really made a difference to us. We were like, wow, this is something important. We can really kind of do things that way. We've been doing it ever since. And right now we have a bottled water distribution program that's really based on those same networks that have grown and grown since then. We might talk a little bit more about that in a minute. I'll pass it back to Lucy.
Thanks, David. I think those 2 examples, and certainly we have many more, including work following a significant fire that took place at a shelter, a transitional housing program that displaced a number of people, of course, other fire-related work, lots of fires, hundreds of fires occur a year in encampments across our county. And so that also led us to some work around really engaging with people on the ground about how we could reduce fire risk and creative ways that we can help support things like, how do people keep warm? How do people have fires to prepare food, but also keep themselves safe from fires? I think all of these examples really put us, thankfully, in a unique situation when the COVID-19 pandemic hit, because we had used these situations and been very intentional about it for a number of years before. It really gave us a strong foundation when COVID hit for us to say, hey, we want to make sure when all of the messaging out to the community is isolate, right? Shelter in place, none of which is possible when you're living on the street. It really gave us the ability to quickly activate and convene a community, which is exactly what we did starting in the beginning of the COVID-19 pandemic. We had weekly calls with hundreds of providers, community, not just community providers, again, but just a whole networks of people that support people experiencing homelessness, to be able to push out information, get feedback from them on what was working, what they were doing, leverage and maximize, as David was saying, water distribution, food distribution, masks, test kits, hand sanitizer, right? All of those things during that peak time that were really, again, started in the years before. And I think that what we have done since then is really make sure that we are continuing to maintain that, right? So again, that ability to surge most extremely during COVID, but we will talk a little bit more about kind of where we are today and the intentional work we've done to kind of continue that momentum and that work through daily disasters, while we have thankfully not experienced significant kind of catastrophic events here in the last several years.
Yeah, we really want to emphasize the importance of involving people with lived experience for their expertise and their input into our planning, our needs assessment, our planning, and our response systems for emergencies. So we've been actively involving individuals with lived experience into our systems of care through in a variety of different ways. But basically, we're looking to them, carrying out different types of needs assessment sessions, focus groups, especially focus groups, and doing things where we have a lunch, have a meeting, ask questions, take notes, and help them turn those into a set of like recommendations. We've done that a few times for various things, but also for emergency planning. And what that does, it also brings people into our community advisory board. It's like an entry point into being more a part of the systems that serve people experiencing homelessness. And it has helped us to really open our eyes to non-traditional, non-in-the-box type disaster planning and response approaches. Those recommendations are reviewed and finalized and updated annually by our consumer advisory board, and they get a lot of circulation and make a big difference. We can take a look at the recommendations, the most recent set of recommendations from our unhoused working group on this. They give their key, what's most important in this most recent one. It was access to clean water, having an extreme heat response that involves cooling centers, outreach teams, transportation, misting stations, being prepared for extreme cold, smoke and wildfire, flood and extreme rain, power interruptions, and now displacement, encampment sweeps that are happening. Each of those areas, they give really good bullet points of what's important to them. And you're welcome to download that, check that out. And yeah, we really recommend that folks can use this kind of as a template, not for what they should do, but how the kinds of questions and the kinds of recommendations that can come out of your patient or population of people experiencing homelessness.
All righty. And the last thing that we really felt like it was really important to talk about during our time here today was really around kind of expanding your response capacity and really thinking about it again, not just when those incidents happen or even prepping and kind of the work around those incidents, but really thinking about policy change and preparedness and how that can inform preparedness. And so again, recognizing, as I started off our talk with you all here today, saying how so often it is go inside, shut your doors, shut your windows. Those are not possible. Really, how do we make sure that the thinking about the needs of people experiencing homelessness are increasingly integrated into the responses, right? Not just of us that are serving homelessness, but into the larger responses within our community, and how we're bringing in and lifting up the voices of people with lived experience within that. And I think one important way also showing the disproportionate impacts of climate change, other things, right? Man-made disasters that, human-made disasters, I should say, that impact people experiencing homelessness is work that Alameda County has been a national leader in around homeless mortality. And so really being able to not only show the impacts as we have tragically seen over the last several years in states like Arizona with heat waves and the deaths that have resulted from people left on the streets, right? Really being able to document, demonstrate that, and push for those changes that are needed. And so definitely want to encourage people to take a look at our homeless mortality report, engage with National Health Care for the Homeless and others in terms of how we really recognizing and tracking those deaths and using them to push for policy change as it relates to responding to emergencies.
Well, thanks so much for joining us and listening to us. You're welcome to reach out to Lucy or myself. Here's our contact information up there. And any questions or ideas, let us know. And we'll give it back to Gabby right now to continue on. Thanks.
We hope this webinar has helped you come away with a deeper understanding of both the homelessness response system and the emergency management system, and helped you consider the importance of centering voices with lived experience when planning for disaster and emergency. Please review the toolkit for a more in-depth dive into getting information about both of these systems. Some of the resources you'll find in the toolkit include key takeaways, collaborative opportunity call-out boxes, and exemplary practice call-out boxes, as well as links to additional tools, templates, and resources. You can also find county-level contacts for emergency planning and response agencies, public health, social services agencies, COCs, and community-based organizations to support your work and to help you be informed. And finally, let's discuss what is coming up next. This webinar is the second in a series of 4. The third webinar will be focused on the second section of the toolkit, Get Connected. The fourth and final webinar of the series will highlight the third section of the toolkit, Take Action. During each of these webinars, we will continue to dive into that particular toolkit section and will highlight exemplary practices that align with that portion of the toolkit. We will continue to offer time to hear from local communities throughout the webinar series in the hopes that other communities may find inspiration and creative ideas on how to support people experiencing homelessness in preparation for disaster or emergency. Additionally, we will be releasing case studies of each of the exemplary practices communities alongside future webinars in this series.
Thank you for joining us for the second webinar for the Homeless Emergency and Active Readiness Toolkit, Be Informed. The recorded webinars and case studies will be posted on our website once available at bcsh.ca.gov/CALICH/heart. If you have any questions about the toolkit, please feel free to email us at calich@bcsh.ca.gov. If you'd like to keep up with CalICH, please like and subscribe. Thank you for joining us.